Okay, good afternoon to everyone. It's a pleasure to be here with you. We are from Brazil. I am Gina Abdala, and this is my actually this job is from my student. He's a physician, and he's working about religiosity as a psychosocial resource associated with resilience among university students. So he is now as a professor and coordinator of the medicine group. I would like to show you resilience. I don't know if you are familiar with this instrument, the CD risk. Everyone knows this instrument is an instrument that's validated in several languages, especially in Brazil. We already have this validation. It's 10 questions about resilience. How do you support that? How do you react? For example, if you are capable of adapting when events occur, changes. So it's 10 questions, and you have a Likert scale from 0 to 4, and so you can measure religiosity and resilience. And religiosity, we use the instrument Duke Durell. I think everyone knows these instruments, right? We have 5 questions to measure the religiosity. And we have the concept here, resilience. That's why I was talking about the struggle to have the concept, because it's not easy to find a concept for resilience. Sometimes we find psychological resilience, but not spiritual resilience. That's why we mix religion and resilience. So here's the concept in MESH, the human ability to adapt in the face of tragedy, trauma, adversity, hardship, and ongoing significant life stressors. Okay? We have a lot of students in our school in Brazil, and they are facing a lot of changing, and they have a lot of stress problems, uncertainty, and psychological vulnerability. So we must take care of them. We have this school that we have internship, and some are studying outside of the school. And another problem is religiosity has been, it's not a problem, it's a good thing. Religiosity has been identified as a potential psychosocial resource that may support emotional well-being. Another thing is that understanding factors associated with resilience may contribute to health promotion strategy in higher education. And evidence suggests that religiosity may strengthen resilience through meaning making, hope, emotional regulation, social connectedness. Okay, our aim is to analyze the association between religiosity and resilience in these students aged 18 to 34 years. They belong to this university in Brazil, a denominational university. The method we use this cross-sectional study and quantitative approach. The setting is this Adventist University Center in São Paulo. We have 1,000 students, more than 1,000 students in this age there. And the participants were 335 university students, and the data collection was online survey. This is the big study that we are doing now. It's a longitudinal study. So Gustavo is just analyzed the previous results in this blue one here. Participants and between 18 to 34 years. But we intend to continue to evaluate these people from 35 until 100 years old. Okay? The instruments that we are using, I already said, is Duke University Religion Index, Duke Durell, and Connor Davidson Resilience Scale, CD Risk 10. Before it was a long scale, but now it's only 10 questions. And here the statistic analysis that we used. So the results is the mean of these students. We found the mean ages was 21 years old, most of them female, single, most of them, incomplete undergraduate education because they are young, 73%, And the religions affiliations is evangelical, 37%, Adventist, 25%, Catholic, 24%, and no religion, 6.4%. The results. We have here aura and nora and intrinsic religiosity. I don't know if you are familiar with this, the index of Durrell, I think so. So the best, less is better, okay? The median. So we have for Aura 2.91, Nora 3.34. The best one was intrinsic religiosity with 1.76. And the total, you can put together intrinsic religiosity 1, 2, and 3. And then we have 5.88 for the mean in this index Durrell. About the study risk 10. So we have the questions here. Higher numbers is better. So I'm capable of adapting to change, handle any situation. The best result we have was to be strong, a strong person. Here, 2.9. And you have this question, adapting to change, 2.87. So the average of the sum is 26.5 from 0 to 40. It could be better, but we have this kind of difficulty with the resilience among young people. This is the association that we did with the previous results between religiosity and resilience. We have a little tendency here with the intrinsic religiosity. I think it's not. No problem. But here's intrinsic religiosity. You have a little tendency, but not is significant. The P is not significant with this result. So we did another evaluation, another analysis with a logistic regression, actually binomial logistic regression. And we found, we divided people with the religion classification, and we found an association here with the, oops, sorry, with the the P 0.01, less than 0.05. So it's significant result. And students with higher religiosity was 76.4%, more likely to present higher resilience. So it was good for us to find that we must increase, this relationship, the intrinsic religiosity with these students. Okay, the discussion. Findings support previous studies linking religiosity and resilience. We have religiosity may function as a complementary psychosocial resource. Religious beliefs may help students cope with adversity and academic stress. And social support derived from faith communities may strengthen adaptation process. And the observed association were modest, suggesting that resilience is influenced by multiple factors and is under-researched. So it's not only one thing that can increase the resilience among these people. Maybe we must discuss or must look for another intervening variables. So the conclusion is, religiosity may represent a relevant psychosocial resource within health promotion frameworks. Spiritual and religious dimensions should be considered in holistic approach to students' well-being. Future longitudinal studies are needed to clarify causal relationships. And, oops, that's it, yeah. And the key here is the references only that you use in this PowerPoint. And thank you so much.